Hi, I'm Dr. Isam with Lubbock Gastroenterology. In today's video, I'm going to talk to you about what an EGD with dilation is and walk you through the steps. Esophageal dilation is a process where I can open up the esophagus, typically when it becomes too narrow. We do this during what's called an upper endoscopy or an EGD, and that procedure itself takes about 15-20 minutes. You're asleep the whole time. And while I'm down there, I can take a look at the esophagus, the stomach, and the beginning part of the small intestine. Now, if your esophagus is narrowed, I can fix it right then and there. I can resolve the issues and also get down to the root cause of what's going on. And this is what we do with the dilation, where we use a balloon to actually open up the esophagus to be bigger so you can swallow better. So why do we do this? Typically for somebody who comes to see me who needs this procedure, they have trouble swallowing, food or water gets stuck, they have nausea and vomiting, they can't clear their throat, they have a lot of secretions coming up. And that typically is due to a narrowing in that esophagus. So what an EGD with dilation does, allows me to find out why you have the trouble swallowing, why things are getting stuck, but at the same time, I can fix it to resolve your issues to get you feeling better. Trouble swallowing is never normal, and it can lead to long-term problems, but also can lead to emergency room visits in the middle of the night. Our job is to get down to the root cause, fix it before it becomes an issue for you, and resolve the issues. And then esophageal dilation usually will fix the problem right away, meaning as soon as we're done, you can hopefully eat whatever you want. Preparation is straightforward. Just like an EGD, you'll eat nothing or drink nothing after midnight. We may have you hold some medications prior to the procedure, but we'll talk to you about this in more detail. Plan for a responsible adult to take you home after the procedure because we give you sedation. During the EGD, you'll be sedated and you'll be on your left lateral side. We'll be constantly watching your vital signs to make sure you can breathe appropriately and make sure that we do this safely for you. Your safety is our number one priority. We'll do things to make sure you are very safe and very comfortable. We'll insert the endoscopy scope and we'll take a look in the esophagus, stomach, and the small intestine and find out why you're having trouble swallowing to get down to the root cause of what is going on. While you're asleep, I'll insert the balloon and we'll inflate it large enough where we can allow you to swallow better and resolve your symptoms. Afterwards, you may have a little bit of sore throat or some minor chest pain, which is very normal. Many patients can start eating soft foods and progress to regular foods that same day. In fact, I have a lot of patients who tell me, I'm able to eat whatever I want now and I feel so much better. If swallowing improves, great. But for some individuals, they may need repeated dilations to get them feeling better. Each case is individualized. Dilations are very safe, but the main risks are causing severe bleeding and a small risk of actually causing a tear in the esophagus that might need emergent surgery. Contact us right away if you have severe chest pain, if you have fevers, trouble bleeding, vomiting of blood, or black stools. If you're having trouble swallowing, if food or water gets stuck, if you're constantly clearing your throat or feeling you have a frog in your throat, talk to us. But whether doing esophageal dilation is going to get you feeling better. Schedule an appointment, visit us at lubbocgastro.com for more information or call us at 806-696-4440. Well, thank you for watching.